Hello everyone, I'm Brun from Tarlac State University College of Nursing BSN 1B. So performance evaluation checklist, assessment of the eyes. So for the preparation, assessment of the eye. So assemble equipment and supplies. We have a cotton tip, examination gloves. Ito na, suot ko na po siya. And then, examination, millimeter ruler and also pen light and opaque cord. So, for the procedure, introduce yourself to your client and verify the client identity and explain to your client what you're going to do and why it is necessary. So, hello ma'am, I'm Arlene-Eens, your nurse for today. From Tarlac State University, may I know your name po? And then, after that is, perform a hand hygiene. So, ginawa ko na siya bago ko isuot tong gloves, etong non-sterile gloves na to para maalis yung mga microorganism. And then, provide client privacy. Close the door and also the curtains. And then, inquire the client has any history of the following. So, family history of the diabetes, hypertension, and blood dyscrasia. And then, eye diseases, injury or surgery. And then, last visit to the ophthalmologist. And then, current use of eye medication. So, and then after that, use of a contact lenses or eye glasses. And then, hygienic practices for corrective lenses. And then, current symptoms of the eyes problems. And then, external eyes assessment. So, inspect the eyebrow of the patient kung okay ba yung distribution ng alignment and yung skin quality and movement niya. So, ma'am, pwede ko po bang inspect po yung eyebrows ninyo? Titignan lang po natin yung alignment niya, tsaka po yung skin movement niya. So, okay naman po siya, ma'am. And then, after that is inspect the eyelashes for the movements, for the evenness rather, and the distribution and direction of the curl. Ma'am, check lang po natin yung eyelashes ninyo kung okay lang po yung ano niya, yung distribution of the hair, tsaka yung movement niya po. Okay naman po siya, ma'am. And then, after that is inspect the eyelids for the surface characteristic position in relation to the cornea, ability to blink, and frequency of blinking. Inspect the lower eyelid of the patient. And then, while the clients are closed. So, ma'am, pwede niyo po bang alisin yung face mask niyo para po mas ma-inspect po natin ng maayos yung yung assessment natin sa inyo po. Check lang po natin yung eyelid niyo. Yun po sa taas. Yan. So, okay naman po siya, ma'am. And then, after that is inspect the bulbar conjunctiva for the color and the presence of lesions. Ma'am, check lang po natin ulit, ma'am. Tingnan po natin kung may lesions po dun sa may bulbar conjunctiva po ninyo. Okay naman po siya, ma'am. And then, after that is inspect the palmar conjunctiva by averting the eyelids. So, ma'am, check po natin ulit yung sa may ninyo, palpebral conjunctiva. Palpebral conjunctiva. Taas po, ma'am. Sa kabila po. So, okay naman po siya, ma'am. And then, after that is avert the upper lids if a problem is suspected. And ask the client to look down while keeping the eyelids slightly open. Ma'am, look down po kayo and slightly open po yung eyes ninyo. Yan, okay naman po siya, ma'am. And then after that is gently grasp the client eyelashes with the thumb and also the four fingers. Pull lashes gently downwards. Ma'am, check lang po natin yung eyelashes ninyo. Pull down, pakita-alis po yung face mask. Ayan. Okay naman po siya, ma'am. And then after that is place a cotton tip to the about 1 centimeter about the lid of the patient, the eyelid, and push it gently downward while holding the eyelashes. So ma'am, ano lang po natin yung ano ninyo, yung eyelid po ninyo. Downward. Sa kabila po. And then, after that is, hold the margin of the everted eyelid of the lashes of the patient. And then, the upper bony orbit with the applicator stick or your thumb. And then after that is inspect the conjunctiva for color, textures, lesions, and the foreign bodies. So ma'am, check lang po natin yung conjunctiva ninyo kung ano pong kulay niya at kung may mga lesions po siya. Tapos po, then baba. Okay naman po siya. And then, after that is, inspect and palpate the lacrimal gland. Ma'am, check lang po natin yung lacrimal gland ninyo. Hawakan. So, okay naman po siya, ma'am. And then, after that is, using a tip of the index, your index, palpate the lacrimal gland. Ma'am, palpate lang po natin yung lacrimal gland niyo. And then after that is observe for the edema between the lower lid and the nose. Ganun po natin, ma'am. Pakialis po yung ano ninyo, ma'am. Okay naman po siya, ma'am. And then after that is inspect and palpate the lacrimal sac and nasolacriminal duct. Sige, ibaba niyo po, ma'am. Okay naman po siya, ma'am. And then after that is using a tip of your index finger, palpate inside the lower orbital rim near the inner canthus. Palpate lang po natin, ma'am. And then after that is inspect the cornea for the clarity and texture. And ma'am, tignan lang po natin yung cornea ninyo. Okay po siya, yung clarity niya. Okay naman po. And then, tanungin natin yung, sabihin natin sa client natin na tumingin lang siya ng straight. And then, hold the pen light oblique angle to the eye and move light slowly across the corneal surface. So, let's assume that this pen is a pen light. So, ma'am, tingin lang po kayo sa isang direction. Ayan. And then, tawag nito, and imumove ko po yung yung etong light na to, and then, slowly papunta po sa cornea ninyo. And then, after that is perform a corneal sensitivity reflex test to determine the function of trigeminal, cranial nerve, and then approach from the behind and beside the client and lightly touch the cornea with a corner of the gauze. So, i-palpate lang po natin, mama. And then, after that is inspect the pupil for the color, shape, and symmetry of the size. Ma'am, check lang po natin yung pupil niya, ma'am. Yung color at yung shape niya. Kung okay ba siya or symmetry. So, okay naman po siya, ma'am. Okay naman po. And then, after that is assess each pupil, direct the consensual reaction to the light. So, ma'am, check lang po natin. Sa kabila po. Okay naman po siya. And then, after that is partially darken in a room as the client to look straight ahead. Ma'am, tingin lang po kayo ng diretso. Or dito na lang po kayo tumingin sa akin. And then, using a pen light and approaching from the side, shine a light on the pupil. So, okay naman po siya, ma'am. And then, after that is observe the response. The pupil should be constrict and direct response. Observe lang po natin yung pupil niya, ma'am. Okay naman po siya, ma'am. And then after that is assess each pupil reaction to accommodation. Tingnan na po natin, ma'am. Okay naman po siya. And then after that is hold an object about 10 cm for the client nose. And then after that is ask the client to look first at the top of the object, then distant object behind the object. Alternate the gaze between the near and far object, ma'am. And then after that is next move the pen light or pencil towards the client nose. And then the pupil should converge, and then record the assessment of the pupil. Use the abbreviation of PERRLA. Okay naman po siya, ma'am. And then after that, for the visual fields, assess the peripheral visions. Assess lang po natin. Tingin po dito, ma'am. Peripheral visions po. Okay lang po. And then, after that is have the client sit directly facing you at a distance 60 to 90 cm. Let's assume that this is 60 to 90 cm. And then, after that is ask the client to cover the right eye with the card and look directly at your nose. So, let's assume that this ID is a card, oblak card. And ma'am, takpan lang po natin yung right eye ninyo. Yan. And then after that is cover or close your eyes directly opposite the client cover eye and look directly at the client nose. Okay naman po, ma'am. And then after that is hold an object in your fingers and extend your arms and move to the object into the should be an equal distance for the client, yourself, and ask the client to tell when the moving object is first spotted. So, ma'am, saan niyo po nakita? Okay naman po, ma'am. And then, after that is, to test the temporal field of the left eye, extend the move your ring arm from the client right periphery. And then, to test the upward field of the left eye. Left eye po, ma'am. Okay naman po siya, ma'am. And then, after that is, the upward field of the vision is normally 50 degrees because of the orbital edge is in the way. And then after that is to test the downward field of the left eye. Okay naman po siya, ma'am. And then to test the nasal field of the left eye, extend and move your left arm from the periphery. The nasal field of the patient vision is normally 50 degrees and away from the central point because of the nose in the way. And then after that, repeat the above step for the right eye of your patient. And then for the extraocular muscle test, assess the 6 ocular movements to determine eye alignment and the coordination. So, stand directly in front of your patient. So, ma'am, tingnan niyo po ito, ma'am. Tingin po kayo dito. 2, 3, 4, and then after that is ask the client to hold the head in a fixed position facing you and follow the movements of the pen light with the eyes only. So tapos na po natin yon, and then after that is mag-move on sa pen light na tayo in slowly periodically so that nystagmus can be detected. And then after that is assess for the location light reflects for the shining pen light of the pupil. And then have the client fixate of a near or far object, cover a one eye, observe for movement, and uncover this. And then after that is assess for the distance visions of and then after that is we're going to visual acuity, assess the near vision by providing a adequate lighting and asking the client to read a magazine or a newspaper. So let's assume that this paper is a newspaper. So ma'am, basahin niyo po. So, assess the distance vision by asking the client to wear a corrective lenses unless they are used by reading only. So, ask the client to sit, nakaupo na po siya, and then stand 6 meters or pwede siyang umupo and nakaupo na po siya. And then, ipapakita natin yung Snellen's chart. Cover the eye not being tested and identify the letter or the character. Let's assume that this is Snellen chart. So, ma'am, tatakpan lang po natin. Titignan nyo po kung ano po yung ando dito. Basahin niyo po ma'am kung ano po yun. And then, after that is, take the 3 readings, right and left eyes and both eyes, and document the findings in the client record. So, we will remove the gloves para ma-sanitize yung kamay natin para mawala yung mga microorganism. And then after performing a hand hygiene, record the client record. So ma'am, normal naman po yung mga findings sa inyo. Wala po kayo dapat ipag-alala. And then after that, this is the end of the the performance checklist of assessment of the eyes of the patient. So thank you po ma'am. Assessment of the ears. So, preparation, assessment of the ears, assemble equipment and supplies, otoscope with several sizes, and then for the procedure, introduce yourself to your client and verify the client identity and explain to your client what you're going to do and why it is necessary. So, hello po ma'am, I'm Arlene Brun from Tarlac State University, from your nurse for today. May I know your name po? Patingin po ng listag. And then after that, provide the client privacy. And before the bago tayo pumunta sa assessment natin, syempre nag-hand wash muna ako para maalis yung mga microorganism sa kamay ko bago ko isuot itong non-sterile gloves na to. And then for the inquire if the client has any history of the following: family history for hearing problems or loss, and then presence of any ear problems or the pain, and then medication history, any hearing difficulty, use corrective hearing device when from whom it was obtained, and then auricles, inspect the auricles for the color, symmetry, size, and the position, and to inspect the position, note the level at the which superior aspect for the auricle attaches to the head with relation to the eyes. Ma'am, check lang po natin yung yung tenga po ninyo. Sa kabila po. And po. And then after that is palpate the auricles for texture, elasticity, and areas of tenderness. Palpate lang po natin ma'am, pwede po. Sa kabila po. Okay naman po siya ma'am. And then after that is gently pull the auricle upward, downward, and backward. I-ano lang po natin ma'am ha. 1, 2, 3. Sa kabila po. 1, 2, 3. And then after that is external ear canal and tympanic membrane. So using a otoscope, let's assume that this cardboard is a otoscope, and inspect for the external ear canal for the cerumen, skin lesion, pus, or any kinds of problems in the ear of your patient. Check lang po natin ma'am ha. Okay naman po dito sa right eye nyo, sa left po. Ay, sa left. Ay, right. Okay naman po siya ma'am. And then after that is attach speculum to the stethoscope. And then for adult, pull helix and back. And then hold the otoscope either the Right slide with your finger between the otoscope handle and the client's head or upside down with your fingers ulnar surface for your against the client's head. Thank you, ma'am. And then after that is gently insert the tip of the otoscope to the ear of your client 1/3. Sa kabila po, ma'am. Okay naman po siya. And then after that is inspect the tympanic membrane for the color and gloss. Ma'am, check lang po natin yung ano niya, yung color siya yung gloss. Sa kabila po. And then after that is gross hearing acuity test. Assess for the client respond to the normal voice. If the client has difficulty hearing the normal voice, proceed with the following test. Ma'am, tignan niyo po kung maririnig niyo po ito Naririnig niyo po sa kabila po. And then after that is perform a watch tick test. And then have the clients exclude a one ear. Out of the client side, place a ticking watch 2 to 3 centimeter and from the occluded ear. And then asking what the client can hear, repeat with other ear tuning for the test. So let's assume that this is the use for the tuning test. Kung may maririnig yung client natin or yung patient natin. Naririnig niyo po ba? Sa kabila po. Naririnig niyo po. And then after that is perform a webinar test. Hold the tuning fork at the base, activate the tapping fork gently against the back of your hand near the knuckles by stroking fork between the thumb and finger. And then after that is place the base of the vibrating fork on the client hand and ask whenever the client hear the noise. Narinig niyo po ba, ma'am? Sa kabila po. Narinig niyo po ba? And then after that is conduct a rhyme test. Ask the client to block the hearing in one ear. Ma'am, takpan niyo po yung sa kabila niyong tenga. And then intermittently by moving a fingertips in out of the ear canal. May narinig po ba kayo, ma'am? Sa kabila po. Takpan niyo po yung sa kabila. Okay naman po, ma'am. And then after that is hold the handle of the activated tuning fork of the mastoid process of the one ear until the client state that the vibration no longer can be heard. And then after that is immediate hold the vibration fork and prongs in front of the client's ear canal. If necessary, push aside the client hair as whatever the client now hear the sounds. Narinig niyo po ba, ma'am? Sa kabila po. And then after that is perform a Romberg test. Have the client stand with feet together. Ma'am, tayo po kayo. And then after nyo po tumayo, ma'am, is close po nyo yung eyes niyo. Tapos po yung paa ninyo ipagdikitin nyo po. Dikit po kayo, ma'am. Ayan po, na-maintain naman po yung balance ninyo. And then, maupo na po kayo, ma'am. And then, after that is document the findings in the client record. And this is the end of the assessment for the year. Thank you po, ma'am. And remove the gloves, non-sterile gloves, and perform a hand hygiene. And then after performing a hand hygiene, record the client record. So ma'am, normal naman po yung mga findings sa inyo. Wala po kayo dapat ipag-alala. Assessment for the nose and sinuses. For the preparation, assessment of the nose and sinuses, assemble equipment and supplies, nasal speculum rather, and pen light. So for the procedure, introduce yourself to your client, verify the client identity, and explain to your client what you're going to do and why it is necessary. So hello po ma'am, I'm your nurse for today. I'm your nurse Arlene from Tarlac State University College of Nursing. May I know your name po? Tatingin po ng listag nyo. And then after that is perform a hand hygiene and wear a non-sterile gloves. And then after that is provide a client privacy and inquire the client has any history of the following: allergies, difficult breathing, sinus infection, injuries to the nose or face, nosebleeds, any medication taken, and any changes in the sense of smell. So for the nose, inspect the external nose for any deviation in shape, size, or color, flaring, or discharge from the narses. So, ma'am, patingin po ka ng ilong ninyo. Check lang po natin. And then, okay na po, ma'am. After that is slightly palpate the external nose to determine any areas of tenderness, masses, or displacements of the bone cartilage. Ma'am, tingnan lang po natin. Ma'am, palpate po. Okay naman po siya, ma'am. And then after that, determine the patency of both nasal cavities. And then after that is inspect the nasal cavities using a pen light or nasal speculum. So let's assume that this is pen light. Ma'am, paalis lang po. Say, and then after that, push the tip of the nose upward with the thumb and of the non-dominant hand and direct pen light into the narses. So, ma'am, tingnan lang po natin. And then, after that is inspect, tip the client head box. Makikita, ayan na po natin. Ayan po kayo, ma'am. Tanggalin niyo muna po. And then after that is push the use a other hand position in the head and hold hold the the light. Ito natin, ma'am. Itaas din po yan, ma'am. And then after that is observe for the presence of redness, the swelling, growths, and the discharge. Check po natin, ma'am. And then after that is inspect the nasal septum between the nasal chamber. Check lang po natin, ma'am. Okay naman po, ma'am. And then after that is facial sinuses, palpate and percuss maxillary and frontal sinus for the tenderness. Ma'am, yan lang po natin. Pakitanggal po yung face mask niyo muna po. And then after that is if palpate and percussion suggest to sinusitis, transillumination should be performed. And then document the findings in the client's record. And then this is the end of the assessing of the nose and sinuses. Thank you po, ma'am. And then remove the non-sterile gloves and perform a hand hygiene. And then after performing a hand hygiene, record the client record. So ma'am, normal naman po yung mga findings sa inyo. Wala po kayo dapat ipag-alala. Assessment of the oral and oropharynx. So for the preparation, assessment of the mouth of oropharynx, assemble equipment and supplies, clean gloves, tongue depressor, 2x2 gauze pads, and pen light. So for the procedure, introduce yourself to your client, verify the client identity, and explain to your client what you're going to do and why it is necessary. Hello, ma'am. I'm your nurse Arlene for today from Tarlac State University. May I know your name po? Patingin po ng listag. And then after that is perform a hand hygiene and wear a non-sterile gloves. And then after that is provide the client privacy. And then for the inquire the client history of the following, we have the routine pattern of the dental care, last visit to the dentist, length of the time, ulcers, and then any dental discomfort and any medication for the client receiving. So for the lips and buccal mucosa, first inspect the outer lips for the symmetry, contour, and color of the texture. Ma'am, check lang po natin yung outer lips po ninyo. Okay naman po siya, ma'am. And then after that is inspect and palpate the inner lips of the buccal mucosa for the color, moisture, and texture of the process of lesion. So, ma'am, inspect lang po natin and palpate lang po natin yung ano ng lips ninyo. And then, after that is use a tongue depressor and pen light to inspect the buccal mucosa and stent the ducts. So, let's assume that this is the pen light. And This is the tongue depressor. And then after that is teeth and gums. Inspect the teeth and gums. Ma'am, check po natin yung teeth nyo and gums. Okay. Tapos po yung gums po nyo. And then after that is inspect the dentures and ask the client to remove and complete the partial dentures and inspect their condition, nothing in particular broken or the wearing areas. Ma'am, check lang po natin yung ano niyo. And then after that is tongue floor of the mouth. So inspect the surface of the tongue for the position, color, and texture. Inspect lang po natin yung tongue nyo, ma'am. Labas niyo po. And then after that is ask the client to produce a tongue and move it from side to side. Ma'am, ano niya lang po yung tongue ninyo, side to side po. Okay naman po siya. And then after that is inspect the tongue movement. Ma'am, patingin po ulit yung movement po ng tongue ninyo. Patingin po. Yan, okay naman po. And then after that is after the inspecting the tongue movement, ask the client to roll the tongue upward, move it from side to side. Ma'am, ano niyo po yung ano niyo, tongue? Side to side and forward. Yan, okay naman po siya. And then after that is ask the client to place the tip of the tongue into the roof of the mouth. Taas niyo lang po, ma'am. Yan, sa roof po. Okay naman po siya, ma'am. Then after that, palpate the tongue and floor of the mouth for any kinds of nodules. Ma'am, palpate lang po natin. Up po kayo. And then after that is use a piece of gauze to grasp the tip of the tongue and with the index finger of your hand and palpate the back of the tongue. So ma'am, let's assume that this is the gauze. Ano yun lang po natin, ma'am? Palpate ko lang po. Say up po. And then after that is ask the client to open the mouth wide and tilt the head backward. And then depress tongue with a tongue blades as necessary and use a pen light appropriate visualization. So ma'am, say up po. Say up. Taas niyo po yung ano nyo. Taas niyo po ma'am yung uli nyo po. And then, after that, observe for the ovula as the client to say so that soft place wrist. So, tinanong na natin siya na mag-asya when the pen light is nakaharap sa mouth niya. And then, oropharynx and tonsils. So, inspect the oropharynx, the color. Ma'am, patingin po ng oropharynx niya. Say, open your mouth po. Ay, yung ano nyo po, tingnan po natin. Oropharynx. And then after that is inspect the one side type to avoid eliciting the gags reflect to expose one side oropharynx. And then after that is inspect the tonsils for the color, discharge, and size. Ma'am, tignan po natin yung tonsil nyo. Nga po. Nga po mabuti, ma'am. Ayun, okay naman po siya, ma'am. And then after that is elicitate the gag reflect by pressing the posterior tongue with the tongue blade. So, yun po, ma'am. Okay naman po siya, ma'am. Then after that is document the client findings. And normal naman po yung mga findings sa inyo. Wala po kayo dapat ipag-alala.